I am the Angioma Alliance President and CEO, and I am really pleased to be able to introduce to you tonight Dr. Christine Petranovich. She is a neuropsychologist at Colorado Children's, and I have a little bit of a write-up. I actually know all this, but I thought I would read it so that I don't mess it up. She's a pediatric neuropsychologist who was born and raised in New Mexico. And she got her bachelor's degree from the University of New Mexico and then went on to Cincinnati, to the University of Cincinnati, to earn her master's and her PhD in clinical psychology. And then after graduate school, she went back to New Mexico to do her internship and fellowship training at the University of New Mexico Health Sciences Center. So as you can tell from that, she's very familiar with our patients because we have so many of them in New Mexico. Then she left there, went to Colorado in 2017, and now she currently practices at Colorado Children's Hospital. And so that's Dr. Petranovich. And then I just want to do one little housekeeping thing before she starts. When you have a question for her, if you could please use the Q&A feature, that would make it easier for us to be able to keep track of the questions and which ones are being answered. I know that there's a chat there as well, but if the questions themselves could stay in the Q&A, that would be great. But then in the chat at the very end of our session, we'll be dropping a link to our support group meeting, which will happen at the top of the hour after this session. It's a separate link, so you'll need to click that in order to get into it, or to copy that into your browser in order to get into it. So without further ado, Dr. Petranovich, thank you.
Thank you so much.
You're welcome.
Thanks for having me. I'm really excited to be here to share a little bit. I'm going to talk a little bit about some of the research that we did at UNM, looking at children and teens with CCM kind of as it pertains to our topic today. But really, I want to focus on supporting children and teens and their complex thinking skills. And we'll talk a little bit about what those skills are, why they're vulnerable for kids with CCM, and then most importantly, as parents, what are some things you can do to help support those things? So here's some things I'm hoping to kind of answer today. This term executive functioning is a term we're going to use a few times, and so we'll talk about what that means. We'll talk about why kids with CCM might be at higher risk for executive functioning problems, how these problems might influence them across different aspects of their lives, so at home, at school, and in social situations with friends. And then emotions and behavior, and then kind of finish with how can parents support their kids that might have some of these difficulties that we're going to talk about. So executive functioning is a pretty broad term that neuropsychologists use a lot, and it means a lot of different things. And I think people are often surprised that so many different things are going to go under the same kind of umbrella or the same term. And the way that I think about this is, if you think about what are the various things that like an executive of a company would do. And an executive of a company does a lot of different things. They help people set goals to complete projects. They help put plans in place. They help keep things organized so that those plans will happen. They help keep people on track. They make sure that jobs get done efficiently. When problems come up, they help think of solutions. And they help monitor the progress as we're going and then make adjustments to those plans if it's not going well. And that's kind of what, in some ways, our executive functioning is kind of the executive of our brain. All these same things are things that would fall under executive functioning. So here we have kind of a little table of all the things that might fall under executive functioning. You can see it's a lot of the same things. So planning, problem solving, reasoning, getting started or initiation, monitoring as you're going and making sure that what you're doing is working out how you want it to be. Being flexible. So if you're thinking of a problem, trying to think of it in terms of different ways that you could approach that problem. And then this one here, my mouse is, inhibition is an important one. And that's one that often comes up in kids as a problem. And that's kind of like putting the brakes up or putting a stop sign on what you're doing. So that's if you're doing something and you say like, oh, wait a minute, that's maybe not the best idea. Maybe I shouldn't do that. That's your inhibition kicking in of saying, nope, that's not a good idea. And people who have executive functioning problems, they might do things, and other people, like parents, might be like, why did you do that? Like, that wasn't a good idea. And it's because of a lack of inhibition. That stop sign or the brakes maybe aren't always there. And so kids might make decisions or behaviors that seem like to others they weren't well thought out. So these are executive functioning. Again, I would kind of just think of what does an executive of a company do? And it's very similar things. This is the executive or the boss of our brain. And kids, I think there's a few reasons to think that kids with CCM might have problems in some of these areas. So when we think about executive functioning just from kind of more like a neurobiological perspective, oftentimes we associate executive functioning with the front parts of our brain, so kind of up here where your forehead is. But there's also been some more research that says maybe that's not quite right, and really to have these skills, all parts of your brain need to kind of work together efficiently for these executive functioning skills to happen. And so if there's any breakdowns in terms of the different parts of your brain all communicating and working together, then you can have some of these executive functioning problems. And so you can, if you think through CCM, where people may have lesions in their brain, or they may have parts of their brain that are not working as efficiently as they could, or some of those lesions might be affecting the different parts of the brain, their ability to communicate with each other, then you can have some of these breakdowns that might lead to executive functioning problems. And then there's other risk factors if we think about kids with CCM that are associated with executive functioning problems. When we think about people that have seizures, people who have chronic headaches, which are common problems in individuals with CCM, those are conditions that are also associated with executive functioning problems. And so when at UNM, we did a study. I'm going to try to move this over here maybe so we can see. We did a study of children and teens to look at their thinking skills in a broad sense in terms of lots of different types of thinking skills. So for this study, we looked at their memory, we looked at their attention, we looked at their processing speed, so just how quickly and efficiently they can do things. And what we found overall is that when we compared kids with CCM to their non-affected relatives, so that means like their brothers, sisters, cousins who did not have CCM, they didn't differ overall when we looked on average. Their skills were pretty similar, which was something that that we didn't necessarily expect. We thought that kids with CCM might show more thinking problems than they ended up doing. So they were actually doing better than we expected on the thinking test, which is a good thing. And something we didn't expect was when we looked at the relationship of thinking skills with how frequently they were having seizures or how severe their headaches were, we also didn't see any of those relationships either. But there were some people who did have some challenges when we looked at the CCM group. And one thing that we did notice is when we looked at their findings on MRI. So we had MRI at time 1 and then time 2. And we were able to look at how the lesions changed or progressed from time 1 to time 2. And what we found is that kids who had greater lesion change, so from time 1 to time 2, developed more lesions. That was associated with being less efficient and a little bit slower to do things. So not in the sense that like they couldn't do things, they were just slower to do them, which suggests that within the CCM group, there is a subset of kids who seem to have greater lesion progression, and that seems to be maybe what's driving some of these thinking problems when they exist. So I think that the takeaway for me from what I got from the results of this study that we did is that as a group, those with CCM were really not looking that much different from their non-affected relatives, but that lesion change and lesion progression over time seemed to be an important factor when we thought about thinking skills. And that for those people who developed more lesions over time, those were the people that tended to be a little bit less efficient and just needed a little bit more time to get things done. And so what happens when kids have these, now I'm going to move this back over here. What happens when kids have trouble with their executive functioning? So we're going to kind of just go through all the various aspects of how this might come up in just kind of everyday life. And school is the biggest one. When I see kids in the clinic who have CCM or other types of neurological problems, school is the biggest one where people bring up problems when this happens because it's I think it's where it's the most obvious because you're asking people to organize, you're asking people to make plans to finish homework, to get their homework turned in. And so if they have executive functioning problems, school is sort of the most obvious place I think people notice it. And so this can come up with a wide variety of different problems. So organizing, forgetting assignments, losing track of them, forgetting to turn them in. And so a lot of times parents have frustrations about like, my kid did their homework and they just didn't turn it in. They were so close. It was in their backpack and it just never made it to the teacher. And it's very frustrating. Planning to get big projects done. So kind of thinking in a sequence of, okay, I've got to get this done by this day. So I need to get started. And here's the first thing I'm going to do. Here's the second thing I'm going to do. Here's the third thing I'm going to do so that I can get it done. Initiation or getting started. So if you have a big project, just saying, here's the first step and then doing it. And that's one of the things that I talk with parents a lot about, that executive functioning problems, that there's kind of a disconnect sometimes between knowing what you need to do and doing what you need to do. And so sometimes people or kids will know, like, I need to do my homework, but actually doing it and getting started is a big step and a place where sometimes people get stuck. Efficiency, so doing things in a way that makes sense. Motivation to get started and to finish. Paying attention to the details, which can result in mistakes and errors. And then poor time management, just procrastinating or not quite estimating correctly how much time it's going to take you to get something done. So these are some of the ways that these executive functioning problems come up at school. Similar things can happen at home. So you're given a chore and you might forget how to do it, or you might procrastinate, or you might get stopped. Getting started on your chores or things that need to be done around the house, doing them in a way that's efficient so they get done in the way that makes the most sense. And then friends, that can be a big one too. So people that have trouble with executive functioning can have problems in social situations. And I think often the biggest type of executive functioning that gets in the way in social situations is that impulsivity, meaning kind of doing things without thinking it through first. And then things can happen that maybe other kids don't really like because the child did something impulsively and it wasn't received well or might have been bothersome to other kids. And so kids who have executive functioning problems, they can be frustrated, easily annoyed, irritated. They can say or do things without thinking it through first. And so maybe lacking personal space with other people, or pushing or shoving without kind of thinking it through before they do that, or saying like just sort of the first thing that pops into their head. And then other people are like, why would you say that? That was mean. And so there can be a number of different ways that comes up socially. Not reading social cues. So other people might be giving them kind of subtle social cues of like, I don't really like what you're doing. And they may not be paying attention. And so it just totally misses them. And then that can impact the social situation. Hard time going with the flow. And so if you think about like younger kids who are playing and kid wants to play another game or play with another toy or play differently, sometimes kids can have a hard time being flexible because they want to do sort of what they want to do, and switching to do something else can be a challenge. And then being impatient, like they want it now, and waiting or being told to wait can be a challenge. And I feel like my text is always on the wrong side where this box is. Okay, and then emotions. So emotional reactions that don't fit the situation. So overreacting to situations. So something happens and the kid might get really sad or really angry or really annoyed, and others around them would be like, that seemed excessive. Like that seemed like an overreaction. And that comes from that impulsivity, that keeping emotions inside or keeping emotional reactions inside is hard. And so just sort of their first reaction comes out and it can seem excessive or like an overreaction. So blowing up easily, overreacting, hard time keeping emotions inside, getting stuck when things don't go my way. So I wanted to do this and I'm being told no, and that can create a lot of tension and a hard time moving on. and tendency to just experience big emotions and having trouble controlling them. And so anxiety and depression can be particularly challenging in kids with executive functioning problems because they may feel those emotions more intensely than maybe other people might. And we did a study of kids. Um, so this was again part of this study that we did with children and teens. And what we did was we asked the children and teens to rate their own emotions. And then those ratings that they gave were standardized for age, which means we then compared them to a large group of people without CCM to see how they rated those emotions. And on average, the affected and not affected groups were not different from each other. And on average, they weren't considered elevated compared to our normative sample, which means that when we compared them to that large group, they sort of just like fit in pretty well with the norm sample on average, which means compared to like the general population or a subset of the general population, they weren't reporting a high level of emotional problems. And so when we looked at the averages themselves, there wasn't a lot to say there because they were pretty normal in sort of both ways that we looked at it. But there was some variability within the CCM group. And there was, when we looked at that variability, there was 18% that reported emotional problems that would be considered like clinically significant or elevated for their age, which means 18% reported many more problems than most people their age would. Um, which, kind of in simpler terms, there's 18% of this group that's really struggling from an emotional perspective and saying, I'm really having a hard time here with my anxiety and depressive symptoms, feeling sad, feeling irritable, that sort of thing. And when we looked at sort of what are some factors that might predict emotional problems within the CCM group, we found a few things that seemed relevant. And one of them was headaches, disability. And so this was just how frequently and how severe headaches were. And kids who had more severe headaches and rated their headaches as more frequent and severe had more emotional problems, which is pretty consistent with headache research, not in CCM, that shows that people who have chronic headaches are at risk for emotional difficulties. And then the other thing that we found was we found kind of statistically what we would call an interaction effect, or that there's two factors that kind of work together to explain emotional problems. And what we found is that kids who were disengaged copers, which means that they tended, some people might call this like denial or something like that, that when we think about how do you cope with CCM or how do you manage hard feelings that come up with having CCM, that these are the people who said like, well, I just pretend like it's not a problem, or I just kind of ignore it. So these are people who tend to just, when they have a hard feeling or something comes up related to their medical condition, who just sort of just kind of sweep it under the rug and say, it's not a big deal, I don't have to deal with it. And we found that people who tended to use that coping style, who tend to be disengaged in their coping style, and if they were younger at the time that they were diagnosed, so that together was sort of the risk factors, being young at the time you were diagnosed and tending to use a disengaged coping style, that group of people seem to be at high risk for emotional problems. And so the takeaway that I took from these findings is that for kids and teens with CCM, emotional problems as a group don't really seem to be too notable. But when we look at, there is a subset of kids, this 18% of people who are struggling from an emotional perspective. And there seem to be some factors that put people at risk for these types of problems. And that included headache severity, and being disengaged in how you deal with your CCM stress if you're younger at the time that you were diagnosed. And so, what can parents do to support their child or teen who may be struggling in some of these areas? And so, this term that we use for to help kids with executive functions is called scaffolding. And it's kind of an interesting term. Like, I'm not I've never built a house before, but as I understand, scaffolding when you build something or when you're constructing something is sort of like the structure that keeps the whole house up, right? And so when you think about scaffolding, what you're doing is you're offering just sort of like the basic structure to help keep your child up or keep them going. And so here's some ways that you can help scaffold for your kids. Help them get started. So if you know that something challenging is coming up, there's a challenging school assignment that might involve multiple steps. Help them get started, and what that means is help them identify what is the first step. What are they going to need? When should they get started so that we're not procrastinating? So if you're like, this is a big project, it's due in a week, maybe we should get started now. And maybe our first step is to get out our computer and start just creating an outline for this essay you're going to write, or just start writing down some ideas of something you might want to include in this essay you need to write. And so starting with just sort of the first baby step and not just telling them like, okay, now go do that, go get started, but actually helping them do it, helping them make sure they have the materials and that, they have a quiet place to sit as they're working. And so really kind of having a kind of sort of hands-on approach to helping to get started. Break down multiple steps into single steps. And so baby steps are really important. And I think a good example is that a lot of times us parents will say things like, go clean your room. And to us, that seems like a very simple thing to ask. But that one thing is actually a lot of different steps because cleaning your room involves making the bed, putting the clothes in the drawer, putting dirty clothes into the laundry, cleaning up the toys. And so when you ask them to do that one thing, you're really asking them to do probably like 4 or 5 different things. And so ask them to do those small things. So rather than giving the big instruction of go clean your room, say, okay, go upstairs and put all your toys into the toy box. And then when that's done, then you say, all right, great job. Now the next step in cleaning our room is to put the toys, is to put the clothes in the dirty clothes hamper. Okay, great job. And then you can work collaboratively to kind of help the child start to realize this themselves of like, okay, now you put the toys away. Let's look at our room and say, what's the next thing that needs to happen? And hopefully eventually your kid can kind of get into the place where they might say, oh, where there's clothes all over the room, and say, oh, that's great, let's put the clothes away. And so we're breaking down this big multi-step task into the individual steps. Be clear and specific about what you're asking. Limit distractions. And so TV is a big distraction, toys are a big distraction. And so like if your child's sitting down to do homework, set up for success by limiting those distractions. Um, Identify common roadblocks and set yourself up for success. And so, like, it's a big roadblock for a lot of parents that I hear is transitioning from tablet time or technology time, screen time. And so, a common roadblock can be that you set limits on what a child might need to do to earn the screen time. And so you'd say, okay, we can't have screen time until you finish your homework. And once this is done, so you need to do your math worksheet, and then you need to do your reading worksheet. And then once that's done, then you can have 20 minutes of screen time or whatever it is. And so you're trying to eliminate the roadblock of having that tension of screen time by making it very clear what exactly the child needs to do to earn that screen time. Choose priorities and target specific behaviors that are important to you. And I think sometimes one of the challenges that parents have is that they may choose too many things that they're trying to work on at one time. And so I think it can be important to just say, okay, what's the most important thing we're working on with your child today? And we're working on getting homework done by a certain time because it's impacting your family's life, that it's taking your child hours to complete homework that probably for most kids might not take that long. So let's build in a schedule and choose the priorities of we're going to do 20 minutes of work time. And if you work really hard, then you can take a 5-minute break. And then we're going to do 20 minutes work time, 5-minute break. And choose that specific behavior and really target that in a very systematic way can be a really important part of reducing some of those things that might be impacting or creating problems in your family. Build reminders into your day. And so there's a lot of good technology and apps on your phone and your tablet that can be really helpful in terms of giving you to-do lists or checklists or setting a schedule so that you and your child kind of both know what's expected and for what duration. Work on executive functioning skills in everyday life. And so this can be a really something you can just work into daily life. Like if you have a child that likes to bake, then say like, okay, let's make a checklist of everything we need to do to make cupcakes today. And then you recipe and check off the steps as you're going. Before we get started, let's get out all our materials. So let's get out the cake mix, let's get out the frosting, let's get out the eggs. And when you're doing that, you're showing your child how to make a plan and how to be organized in terms of executing that plan, because you have a checklist, you're checking it off, you get out all your materials together, you've limited distractions. And that's a way that your kid can see like, oh yeah, like this works out when we do this. And then when you're doing something that's maybe not as fun, like homework, you can say, well, let's do a similar thing like what we did with the cupcakes. Let's make ourselves a to-do list. Let's get all our materials out. Let's get rid of all the things we don't need so we don't have distractions. And so you can build in executive functioning skills into things that are enjoyable so that then it's a little bit easier to integrate those skills into things that maybe aren't quite as enjoyable. And then show your child how you use your executive functioning skills in everyday life. So when you're having breakfast in the morning, you can say, okay, like today we have 3 errands we need to run. I'm going to do this one first. And the reason why I'm going to do this one first is because it's closer to the house. And then we're going to do the other one second. And then I'm going to make sure that we do the third one last because we need to get home by lunch. And it's okay if we don't get the third one done. And so your child can kind of see like, oh, that's how you make a plan. And that's how you think about things in a systematic way, so that eventually they can become more independent in doing it themselves. In terms of school, a lot of kids who have neurological disorders like CCM are eligible for formal supports at school. And this is the biggest part of my job, is trying to help understand what the problems are and what the specific type of thinking problems that kids have, so that then we can make like a school plan or a school roadmap for what are the things that should happen at school to support this child. And so if you're thinking like, a lot of these executive functioning problems really sound like my kid, you may benefit from having kind of a formal evaluation of thinking skills to better understand what exactly are the types of problems that your child's having, and what are some supports that might be available at school to help with those things. For some kids, this involves accommodations like preferential seating or reminders to turn in homework. Some children might qualify for like one-on-one time with like a special education teacher to kind of focus on executive functioning skills at school. And then there's like formal curriculum programs that can be integrated into your child's education that work on these skills kind of in the same way that kids learn reading or math. They can learn executive functioning skills. And we talked about emotions and what are some ways that you can help your kid or your child regulate their emotions. And so one of the ones is to be engaged. And if you remember, one of the predictors of emotional functioning that we found in the study we did was that people who tended to disengage or pretend like their problem wasn't a big deal tended to have more emotional difficulties. And so it does seem important to be engaged in terms of how you cope. And so this is important for both parents and their kids. Our study indicated that this was especially important for kids who were younger, if younger at the time that they were diagnosed with CCM. And so some of the ways that you can be engaged is just to find somebody that you trust and confide in them. And so the fact that all of you are here and engaging in this program and learning more and being part of the support group, you guys are already engaged because you're finding people that you can trust and that you can confide in. You're educating yourself. You're learning more about what you can do to solve the problems that you might be having in your family. And that's a very engaged thing to do. So talk to families, friends, mental health professional support groups. Take care of yourself, see your doctor regularly, eat well, exercise. find time for activities that you enjoy. And I know with COVID, this is hard for everybody. It's to find things that you can enjoy because a lot of things are closed and you can't do things in large groups and that sort of thing. But so this is certainly more of a challenge, but if there's things that you enjoy, making time for them is really important. Finding time to relax and just do kind of self-care type of things. Educate yourself so that you know what options are available to you and to your family, and then find solutions to the things that are within your control to manage. And so some of these solutions might be, if my kid's really struggling in school, maybe I need to have an evaluation so I can figure out what my options are to better support. And so that's a way to seek solutions. Maybe I need to talk to my child's doctor to see if he or she can help me come up with ways to work with the school so that school is not as frustrating or hard for my child. And so these are ways to seek solutions to things that might be challenging for your family. And then headaches seem to be another important thing when we think about emotional problems. So, again, depressive symptoms, anxiety, that sort of thing. And when we think about headaches, headaches have far reaching consequences. The headache research shows us that it worsens emotions and thinking problems. It creates problems with sleep. And when you have problems with sleep, if you haven't had a good night of sleep the night before, you're not going to be at your best. And that's definitely true for me and anybody, CCM or not, is that it's hard to manage your emotions if you're not getting good sleep. So, what can you do if your child's having some problems with headaches? You could consider medication. You can work with a pain psychologist to think of ways to manage pain and emotional factors that might be influencing pain. Um, Meditation and other relaxing activities can be really helpful in terms of managing pain, but also managing emotional problems. And there's a lot of meditation apps that are really popular. And so some of them are like Headspace or Calm are some examples of apps that sort of guide you through meditations to help with relaxation. And then good sleeping practices. Go to bed and wake up at the same time each day because your body sleeps better if you're on a consistent schedule. Don't lay in bed for long periods of time if you can't fall asleep because this increases frustration and kind of introduces emotions. And so now it's going to make it even harder to fall asleep. And so it seems a little counterintuitive to a lot of people. Um, if you're not asleep within like 10 or 15 minutes of laying down, get up and go do something else that's relaxing. So go have a cup of tea, read a book, talk to somebody who might still be awake, and then try again, because that will reduce frustration and make it more likely to fall asleep. And then only use your bed for sleep. So don't do homework, TV, anything else. Make your bed just a zone for sleep because then that cues your body that whenever you're in bed, it's time for sleep. And so, thank you for your time. And I just also always want to just give a plug to everyone who participated in the studies that we did at UNM, that I'm just exceedingly grateful to everyone who gave their time and their information, because I think we learned a lot of things from the studies we did that help us to provide good clinical care for people with CCM. And here's my email address. Anybody who has any questions, you're definitely feel welcome. We'll do some questions now, but absolutely, if you think of something later, or if you think of something that you'd like to know more about, I'm happy to try to address these questions as best as I can.
Thank you. Thank you. We'll also drop your email address into the chat because I'm going to ask you to take your screen share down so that I can ask you like the whole bunch of questions that have been piling up over here. I can start in. I think the first group of questions was about the research that you were discussing. And not the main question, but the first question is, when you say younger kids are having emotional problems, what age are we talking about with that?
Yeah, so it seemed like the age that kind of ended up being kind of the dividing is that kids who were younger than 5 at the time that they were diagnosed seemed to have more emotional difficulties longer term. And I think that there's a few reasons for that. And this is actually a finding that's come up in other neurological disorders as well, is that kids who are younger at the time that they're diagnosed seem to have more risk factors. And if you think about sort of that sort of just changes your trajectory as a child in some ways, because you kind of grow up as a child who has, a problem, and you may be limited from activities that other kids are. Like as a parent, you might make a very reasonable decision of that you don't want your kids to participate in some sports or something like that. And so from a young age, kids feel different. Like they feel like there's something that's different about them, and that kind of shifts their emotional trajectory in some way. And so it seems like kind of those kids being kindergarten or younger, when they find out that they have CCM, that seems to be a risk factor for longer term emotional problems.
And does it matter what brought them to diagnosis, whether it was hemorrhage or seizure, or just because their parents had the illness and they
Mhm.
got it?
We didn't look at that, but that would be an interesting question. That would be something I should dig into a little bit more if there was kind of if we could be a little bit more detailed in that. That's a great comment. Thank you, Connie.
Okay. And I'm about to I just typed your email address. So if I got it wrong, let me know and I'll try it
No, that
again.
looks right. Thank you.
Okay. And then the other part of the question was, you said 18% are having pretty serious emotional problems. When you look at the general population of kids,
Mhm.
what percent of them are having emotional problems?
Yeah, yeah. So the rate in kind of the larger population is somewhere between like 8 and 10%. And so when we think, 18% versus 8 to 10%, that is quite a bit higher than the general population. Even, 18% doesn't sound like a lot, but it is higher than in the general population.
Okay. And then one more question again on the research. This is really interesting research. So the early diagnosis has an impact on the emotional problems that a kid has. Does it also, do you think, have you noticed anything about the cognitive challenges that kids
Mhm.
go through? Is it earlier the diagnosis, the more cognitive
Yeah,
challenges?
yeah, and I didn't go through the cognitive test data in a lot of detail, but we did find quite a few effects that influenced processing speed in particular, so that efficiency and how quickly kids can do things. And one of them was younger age at diagnosis as well. And then we talked about that the headache severity was another important predictor of processing speed in particular.
Okay. All right. Now shifting off of the research, at least for a moment, until there are more questions about it. We have a number of people have asked a very similar question: is there any research to connect CCM with attention deficit disorder, autism spectrum disorders, sensory processing disorders, and other neurodevelopmental disorders? And about
Mhm,
3 different people asked that same question in
mhm.
a variety of ways.
Mhm. So, in the parent questionnaires that we did, um, I'm not going to remember the exact percentage, but there was a pretty high number of parents who reported elevated attention problems on that questionnaire that is standardized for age as well. And so we did see that there does seem to be elevated risk for something like attention deficit disorder. Um, Autism spectrum disorder is not something we specifically assessed for in the study, um, but there are kind of like constellation of symptoms on these questionnaires that might raise concern for autism, and we didn't see that. So I think that might be something to consider for future research on like more specifically looking at autism, but we didn't see kind of on like our screenings that we did of just parent concerns. They didn't seem to show that constellation of problems, but that would be something that I think we would want to look into in more depth potentially. Um, but all of these things, neurological disorders do confer higher risk for various developmental disorders, with ADHD probably being the most common. So I would say risk for ADHD. Um, Sorry, that I saw that comment popped up. Yes, it is at childrenscolorado.org. Yeah, you're correct. Um,
Sorry.
yeah, so ADHD would be I would say the most, probably the most common of the common developmental disorders, something that was interesting that we found when we did the cognitive testing is that compared to the non-affected relatives, there was kind of a trend in the direction that kids with CCM showed more reading problems as well. And so I think another developmental disorder to kind of keep in mind that might have some potential risk is like a learning disorder or learning disability. And what we found in our sample of kids is that a high number of the kids had IEPs or individualized education programs at school, and that the most common eligibility for them was learning disorders. And so it seemed like there were a high number of kids who had learning disorders as well.
Okay. And then did you happen to see a correlation between the number of lesions and increased emotional issues?
We did not. So that was interesting that the imaging findings did not seem to be related to the emotional issues, only the cognitive issues.
And then are you, when you talk about the younger children being diagnosed, does it seem like those kids have a more severe disease than kids who are older?
Yeah. And so I think that that was a question that I've been kind of like diving into more recently is did the kids who had MRIs differ from the kids who didn't have MRIs? And because we didn't image the whole sample of kids just for kind of logistical financial reasons, because MRIs are expensive. And so we didn't see that those kids differed in terms of their cognitive test performance or any of those important indicators. But I think that it would make sense that kids who are younger at the time that they're diagnosed, that they're probably younger at the time of diagnosis for a reason, that they've had some sort of complication or they have like a strong family history or something like that that brought them to medical attention earlier. And so I think conceptually it makes total sense that younger age at diagnosis would probably be associated with kind of more severe condition.
Okay. Here's a very practical question. I'm trying to decide what kind of school my toddler with CCM should go to when she's older. How would I find out which schools, public and private, would provide good supports to my child with CCM related challenges? Are
Mhm.
there liaisons at school districts or nonprofits or elsewhere who can offer this info? And this is a question not from somebody in Colorado or New Mexico, but elsewhere.
Mhm. Yeah. Um, so I think for what maybe the first question about having school liaisons, there are a number of nonprofits in a lot of states. In most states that I've worked in, there are some of those resources through nonprofits that offer like school advocates or something like that. Um, I think also at the children's hospital I work at, which I recognize is kind of a larger children's hospital, we have a school advocate that works in our department. And so when we've identified kids that need help identifying educational resources and communicating with the school, then we have somebody on our end, on the hospital end, who does that. And so maybe if you live somewhere or you're connected to a children's hospital, they might have that either within their own system or they might be able to identify somebody in your community that has that. In terms of, your question of public versus private schools, I think generally, there's obviously a lot of really good private schools out there that can offer a lot of support for kids who might be at risk for learning problems. But I think the thing I always throw out is just to keep in mind that private schools are not obligated to offer your child accommodations or services but public schools are. And so if your child qualifies for these accommodations, like through an individualized education program or a 504 plan, that's kind of a binding document that the school is going to provide these things that has been determined that your child needs. Private schools are not obligated to do that. And so I think that's just for kids who may be at risk for learning problems, that's just an important thing to keep in mind is that you would have to feel very confident in this private school that you're considering because private schools generally may or may not offer those services depending on which it is.
Um, some more biology type questions. Does CCM cause delays in babies in talking and walking? Can it?
Yeah, so we did ask about developmental delays. The problem with developmental delays, and as a parent, I can totally relate to this myself, is that it's hard to remember exactly when your kid did all these things. And so when parents participate in studies and we say, how old was your child when they walked, when they talked? And now these kids are older, they're teenagers, that I think parents are probably offering in some ways just sort of like relative guesses in terms of what they remember. And so I think that just thinking about the data that we collect is not super exact, because it's hard to be exact as a parent when you try to recall developmental milestones. So we didn't see differences in terms of between affected and non-affected relatives in terms of when parents are reporting their child's development, like those early milestones, walking, talking, potty training, all that stuff. But just keeping in mind that that data tends to be pretty limited, because parents, some parents do, but a lot of parents don't have very specific memories of exactly when that happened.
Sorry, I muted myself. So is it possible for a neuropsychologist to detect lesion progression or some of the actual changes that are happening with the disease, or does somebody need to have an MRI in order to know that something's happening?
So if you're specific, if you're specifically wanting to know about lesion progression itself, that would be an MRI. But if you're wanting to know the impact that lesion progression is having on thinking, then that would be something that a neuropsychologist would do. And so, like for this study, we worked with a radiologist who did the MRIs and calculated the lesion progression and all that kind of stuff. And then I use that data to see if it corresponds with the cognitive data that we generated. And in this case, it did. For processing speed. And so I think it depends on your question. If you just want to know about lesion progression in terms of number of lesions or lesion volume, then that would be an MRI. But if you want to know like how is that impacted my child's thinking or functioning or development, then that would be a question for a neuropsychologist.
Okay. Back to lesion burden. So if there may not be a correlation between the number of lesions and cognitive problems, but what about lesion burden? Like if you have 3 big lesions, is that more debilitating than 20 little tiny lesions?
That does seem to be the case. And so what we did was we looked at large lesions and then small lesions, and then we looked at overall lesion volume. So just sort of like how much space are those lesions occupying in your brain. And what we found is that large lesions, when it came to processing speed, seem to be the most impactful. So those big lesions seem to be more impactful than the small ones. And I think like neuroanatomically, there's probably reasons for that large lesions are sort of displacing and creating more problems in terms of a large lesion is going to kind of your brain and that sort of thing. And so I think that there is a reason to think that large lesions are potentially more impactful than the small ones. But I think that there probably is more that we need to learn about lesion volume and other ways to calculate what comes from an MRI of what might be relevant.
How do public schools accommodate for significant working memory or attention challenges? What types of strategies are helpful, and what type of therapists help with these challenges?
Yeah. So it depends on the severity of these challenges. If they're relatively mild, then they can do things like seat your child near the front of the class so that they're more likely to pay attention, do like frequent check-ins to be like, hey, are you paying attention? Are you working on your work? Are you paying attention to what's important here? Giving extra time, because a lot of times kids who have problems focusing take longer to get their work done. And so they can offer some of these accommodations. For kids who have more significant or more severe attention problems, they can get kind of one-on-one instruction, because a lot of times kids, if they have attention problems, they're more likely to zone out if they're in a group of 20 or 30 kids, a large class size, versus if they're working in a small group or a one-to-one situation, they're probably more likely to stay engaged and pay attention. And so I think that can be another way that neuropsych testing can be valuable in terms of how severe are the attention problems, and then deciding what accommodations are most appropriate given the severity of the problems.
Are there resources for the littlest of kids that are diagnosed at a young age, as since their learning deficits are already pronounced in some cases early?
Resources just in terms of broad resources, or like resources like more specific to?
Well, actually, they're asking recommended area of support. Is there a resource or recommended area of support? I know
Oh, okay.
I can share that because my
Mhm,
daughter was diagnosed at 4 months and had some significant delays. Most
mhm,
states have early intervention programs for
mhm,
children.
mhm,
Our state in Virginia had one program that she was part of until she was 3, and then she transitioned into a different
mhm.
program. And I think that might be a national thing that
Yeah, well, that's what I was gonna say. Is a lot of states have early intervention, and so then they get like speech language, occupational therapy, behavioral therapy, physical, like whatever they need, that can be offered. And then a lot of states have, I think a lot of states call them like Head Start preschools, but they're early intervention preschools that essentially offer a pretty high level of support, more than most preschools, for kids who might be eligible because they have a medical diagnosis or are at high risk for learning or developmental problems. Because definitely earlier is better. Like if you know that your child's having problems, the sooner you start to work on fixing those problems, the better their long-term outcome is going to be. And so that's one of the things I always encourage parents is, if you have concerns, try, learn more about them as early as you can so that you can start working on them as early as you can, because that's going to lead to better outcome for your child. A problem is easier to solve when it's a smaller problem rather than waiting for it to become a bigger problem.
Okay, and then on the other end of the spectrum, there are two people who are asking about transitioning their kids into adulthood.
Mm-hmm.
Are they going to need lifelong assistance? Is there some way to help them find employment and live independently? What is it
Mm-hmm.
that we can do for our teenagers who are starting
Yeah.
to think about being independent?
Yeah, that's a great question. And transitioning into adulthood for people with neurological disorders is so hard because you have to do so many that you're transitioning, you're thinking about living, employment, socialization, but also medical. Because a lot of kids who have been treated through children's hospitals now have to kind of start over and go to a different hospital. And that can be a really challenging thing if you've worked with your same providers for years and years. Um, so there's a number of transition to adulthood things that I can send to Connie if you're not already familiar with them, on like transition to adulthood guides for people of all ages, that could be helpful. But I think one of the other things to keep in mind from a time your child's really young, if your child has pretty notable developmental problems, a lot of states have developmental disability waivers, which offer long-term supports for people who have developmental problems, kind of throughout childhood. And those can be really helpful, I think, in terms of, because that offers like a caseworker to help you identify living situations. A lot of places have, even if you don't qualify for the developmental disability waiver or don't have it, a lot of states have like a divisional of vocational rehabilitation. And that can be a really helpful resource in terms of finding like jobs and developing job skills and those kinds of things. And so if you have a transition age child, I would recommend looking at the Division of Vocational Rehabilitation for your state, because that could be a good place to think about jobs and job skills and that sort of thing. But I would also look into the developmental disability waiver for your state as well, because that can offer a lot of really helpful resources in terms of thinking about, things like health insurance, but also independent living and a lot of things. So those would be kind of the two biggest resources that come to mind. But I'm happy to share with Connie some of those other like transition guides, because that could be helpful as well.
Yeah, and I can tell you our family has benefited from all those things.
Yeah.
Yeah. And so, and then part of the same question, but another part of it was, so if the kids are doing these executive functioning, skills building things throughout their childhood, is that going to be something that they can carry into adulthood without having to continue to be in treatment, or do they lose it if they're walking away from their neuropsychologist?
Well, I think the challenge of executive functioning is that they change with age, right? Like the executive functioning skills that you're going to learn when you're 5 are different from the executive functioning skills you're going to need when you're 10, are different from the ones that you're going to need when you're 20. And so it's kind of a moving target in some ways because they progress over time. And so, I think a lot of people who work on executive functioning skills find that it's just an ongoing process to learn these. And so it's not that your child's going to lose them, it's just going to be that there's new ones that come with age. If you think about executive functioning skills in adulthood, a lot of what you're doing is like managing your bills and paying your bills and keeping up with your rent and making sure you've done grocery shopping and laundry, because all of these require planning and organizing your time. And so, yeah, so I mean, it's just always new frontiers of things that you need to do. And so it's a lifelong process to build them.
Okay. Then a question about genetic testing. So knowing that there's the potential with this illness for developmental delays and that there's the ability to do some interventions, does it make sense to have our kids who are known to be at risk because they have affected parents get tested early to find out, even maybe before symptomatic, to find out whether or not they have the mutation, or do we wait until they have symptoms?
I think that that's a personal choice, because there's a lot of difficulty that can come along with knowing um, the result of that test. And so I can appreciate why people would feel apprehensive about doing that. Um, that said, as I mentioned, my personal thought, or I guess my professional thought as well, is that it's better to know than to not know, so that if there's a problem there, you can start to work to address it. And so knowledge is power, because it gives you a way to start to control problems if you need to. So that would be my thought, is that if you know that your child's at risk, I would, have a family discussion and start to think about if that makes sense for you to do it, because I think there is reasons why you would want to know early, so that you can start to work to proactively address any problems that might be there.
Do you have suggestions for ways to talk to your child when they feel sad about being different from other kids? What kinds of statements, words, or phrases should be used or avoided?
Hmm. That's a really great question. I mean, I think my biggest piece of advice is just to be genuine, to not think that you have to like say the perfect thing or have like the exact right sentence and the right phrasing, but just come across as the warm, compassionate parent that you are, in terms of understanding where your child's going through. Um, but I think it's also important just to, some of the skills that are important when people are struggling is to show that you understand. So if your child is saying, I'm sad because, I want to play football and I can't, be like, yeah, I can get that. Like, you're at school, you see the other kids playing football and it looks like fun and you want to do it. And that would make me sad too. So you don't necessarily have to say the exact right thing. It's just showing that you understand sort of where your child's coming from.
Mhm.
And then, as we talked about with coping, it's important to kind of try to problem solve and to try to come up with solutions to things you can. And so if you say, you want to play football, and I'm sorry, buddy, that just isn't the right thing, given, all the medical things and what the doctors have told us. But is there something else we can do? Like, is there something else that seems fun that maybe we could do instead? And so trying to kind of not come across as dismissive of your child's thing of like, I get you that you want to play football, but maybe there's something else that would be fun too. And let's work together to see if we can come up with ideas for that. So, be warm, be supportive, but be genuine, and talk with your child in the way that you would normally talk with them, so that they know that it's you there talking to them. And but also try to be as engaged as you can in terms of controlling the things that are within your power to control them.
Great. We are out of time. We do have people saying, I would love a follow-up session around the topic of kids and cognitive processing disorders and a bunch of other things that I can send you later to see if you have any interest or thoughts, whether you could do it or whether you could suggest someone who might be able to offer these. I think
Yeah.
just already you've answered 21 questions and there's at least another 5 in the queue and some more in the chat that I didn't even bother looking at, because
Okay.
this has been great. And
Yeah.
I want to thank you. And it's so good to see you again.
Yeah.
And
Lovely to see you too.
And everyone there in the chat right now is the link to the registration for the support group that's going to be starting in just a few minutes. If you need a bio break, that's fine. You can go do that and then go join the group, but you'll need to click that link. Someone is asking, will there be a recording of this session? There will be. We close caption it manually, so probably won't be up online on our YouTube channel until the end of the weekend. But it will be up there so you can watch it again. And hopefully you got Dr. Petranovich's email address, which I later on typed correctly in the chat. And if you didn't, you can always email me. So wonderful. Thank you.
Thank you all.
Thanks.
Thank you so
Good
much
night,
for your
everyone.
time. Bye-bye.
Bye.